Well, more than 68% of trafficking victims are seen at an emergency department, and that is why healthcare workers are vital partners in the fight against human trafficking. And as we found out, a person's life expectancy can actually be impacted by the treatment they receive when they finally seek care.
Some studies saying like you lose 20 years on your lifespan without appropriate intervention and support through these traumatic events.
Emily Huggins is the manager of the Forensic Examiner program at WellSpan York Hospital. The program began in 1988 and has really grown since the early 2000s.
Abuse and trauma is a root cause of health disparity. So we wanted to try to do better.
And they have, with many updates being made to the unit over the years with domestic violence and human trafficking victims in mind.
We need to first realize that these things happen. We need to recognize when we're seeing the signs in our patients, and we need to react in a way that isn't going to re-traumatize the patient.
That includes offering victims a safe and secure space here in the Forensic Examiner suite, away from the chaotic emergency department. Staff is specially trained to handle the immediate physical and emotional concerns a patient may have. WellSpan offers online courses for all employees to learn about what signs to look for in trafficking victims. Those warning signs are many, but include appearing malnourished, showing signs of physical injuries and abuse, avoiding eye contact, social interaction or law enforcement, lacking identification, or having poor physical or dental health.
There is not one agency in our community that can do it all. So we have developed trusted partnerships with organizations like the YWCA of York.
Crystal Perry is the Human Trafficking Advocacy Coordinator at the YW of York. She goes into businesses and schools teaching about the warning signs.
It seems like every time we do a training with a different agency, within a week or two, they're identifying something.
She says it's important that people understand anyone can become a victim.
I've had people that were making six figures lose their jobs and ended up getting trafficked because of their situation.
Approaching care from a trauma-informed standpoint, both organizations hope to spread the word that human trafficking does exist in our area and has for some time.
It's always been here, but now because of education and knowledge, there's more of a light on it.
From the immediate physical and emotional health care concerns to the longer-term mental health and substance abuse issues, trafficking survivors often need a complex array of health care services, and providers are stepping up to make sure they are prepared, as are other agencies across the state.